be recorded. So Laura, are you happy to put the recording on?
Yes, it's on.
Lovely, many thanks. So welcome to this afternoon's workshop for medical needs in schools. I'm going to introduce our speaker for this afternoon. She is Dr. Isabel Burgess, who is an associate specialist paediatrician with a special interest in chronic fatigue syndrome. Dr. Burgess has been running the paediatric chronic fatigue syndrome clinic at Ipswich Hospital for over 10 years, working closely with colleagues in physiotherapy and in education, and she's passionate about multi-agency working. So we spend quite a bit of our time liaising, don't we, Dr. Burgess? So I'm really grateful that you are able to join us and share your expertise with us for medical needs in schools. So without further ado, I'm going to mute my microphone and hand over to you. Thank you for your time this afternoon.
Thank you, Kate. I hope everybody can hear me. I'm a little bit croaky this afternoon. So as Kate said, I set up the chronic fatigue clinic around it's actually 15 years ago. I worked out today, and obviously seen a lot of children and young people during that time. So trying to get the slides to click now. So this afternoon I'm going to talk just a little bit about definition and diagnosis of chronic fatigue, the symptoms and presentation, and then some principles of management and bringing into that how we can support children within school. So the diagnosis of chronic fatigue actually has changed recently. We've never had national guidance of one set of diagnostic criteria, but the long-awaited updated NICE guidance actually just came out earlier this month, and that does give a sort of clear layout of symptoms for defining chronic fatigue syndrome. So that's what I've put in the presentation today. So in order to diagnose chronic fatigue in children or in adults, you have to have these four basic symptoms that you can see on the slide. The first one being fatigue, and the important thing here is it's debilitating fatigue, so not just feeling a little bit tired, but absolutely exhausted. And fatigue also includes things like muscle aches and pains. It's not just tiredness. And also that has to be worsened by activity, and importantly not significantly relieved by rest, because we all get fatigued if we've overdone things, but usually we rest and we get better. So children with chronic fatigue will rest and they still feel tired afterwards. Really important symptom of chronic fatigue is the idea of post-exertional malaise. So this is the fact that you experience the symptoms after exercise, but not necessarily straight afterwards. So you might appear to be fine while you're actually exercising or exerting yourself, but then you will experience the symptoms perhaps later the same day or even 1 or 2 days later. The sleep disturbance is not just feeling tired, but it's also unrefreshing sleep and sleep problems, which we'll cover in a bit more detail. And then importantly for schools, the idea of brain fog or cognitive difficulties. So you have to be looking for all four of those symptoms. And then in addition to that, is the important one is that this is affecting, significantly reducing your ability to engage in your normal day-to-day activities, which obviously for children and young people will be educational. For adults, that would be employment, and also your social or personal activities. And importantly with children, sometimes we see that actually they're maintaining their school attendance, but it's at the cost of that social and personal activities. So you may not necessarily see initially that there's a problem, but perhaps they're managing in school, but then they're sort of collapsing all weekend and resting all weekend in order to maintain the school attendance. Symptoms also must not be able to be explained by another medical illness or psychiatric illness. And this has changed with the new guidance in that in children, we used to not even consider a diagnosis before having symptoms for 3 months. Now the new guidance says we should suspect chronic fatigue after symptoms just for 4 weeks and then go on to confirm after 3 months. Although in reality, by the time children have been referred to clinic, they usually would have had symptoms for a lot longer than that. So those are the four main diagnostic criteria, but there's also a lot of other symptoms that often go along with chronic fatigue, which you may or may not also see with other illnesses. So things like the sore throats. Now, sore throats, it can be a viral sore throat that's perhaps triggering your chronic fatigue, but conversely, you can also have sore throats as a symptom of your chronic fatigue. Painful swollen lymph glands, aches or pains in muscles, headaches, dizziness, palpitations, fainting, feeling nauseous, often worse first thing in the morning. Temperature hypersensitivity, so some children will feel extremely hot all the time, they're unable to sleep under the bed sheets, and also other children may feel the opposite, they may be extremely cold all the time and unable to go to warm up. You can also have painful joints but without swelling or redness. And some children can be very hypersensitive to touch, so just a light touch on the skin would leave them feeling very painful. Sometimes they complain of pins and needles, and also abdominal pain, and we'll cover some of these again later on in the talk. Severity is divided up into 4 different categories. Most of the children that we see tend to be in the mild to moderate rather than the severe and worse than that. So mild will be most of the children you see. They'll still be attending education, but likely to be perhaps on a reduced timetable, needing to rest at the weekends. And as I said before, they might have reduced their leisure activities. So they might have stopped their after school swimming, or in younger children, brownies or cubs, and they're sort of compensating out of school for that. Moderate category is children who perhaps simple daily activities like getting dressed and having a shower in the morning will leave them exhausted. They may be not able to walk about as much as others. They're needing to rest most days, often not in education or in very reduced education, and sleep is usually very poor. The severe category, I've probably only usually got 1 or 2 of these at any one time. Really, these children are often bedbound or in a wheelchair, often unable to leave the house. Activities, even just such as washing their face or brushing their teeth, will be all that they can manage. They're really not able to concentrate on anything cognitive, so even just 5 minutes of schoolwork would leave them absolutely exhausted. And as I say, they spend most of their time in bed. And then there's a very severe category, I think, tends to be more in adults, and these would be in bed all day and totally dependent on care, including personal hygiene and eating. The risk factors for chronic fatigue, I guess the idea we have in our heads is that it's the sort of upper middle class yuppie flu. That's not actually the case. It does tend to be more girls than boys in the 3-to-1 ratio, but actually it's more in lower socioeconomic class than the middle and upper classes. It often follows on from a viral illness such as glandular fever, and obviously now we've got the COVID and long COVID, which would fall under the category of chronic fatigue. And twin studies have shown that there is an inherited risk to chronic fatigue. So the understanding of that is that you inherit a susceptibility, and then that's then triggered by something like a viral illness or something else. So following on from that, we often see in families that perhaps a parent or a sibling may also have chronic fatigue. So I'm just going to go through some of the symptoms in a little bit more detail, starting with sleep. And it's not just what you might imagine of just being tired all the time. Often these children are very tired in the day, but then they kind of become overtired and struggle to get to sleep at night. They often may be awake until 2, 3, 4 o'clock in the morning, struggling to get off to sleep. And then once they do fall asleep, they have very disturbed sleep. They're waking up repeatedly through the night. Which means that then often they're sleeping later into the day, and sometimes then they're sleeping till later in the afternoon. They're often needing daytime sleeps, and the sleep is unrefreshing. So when they wake up in the morning after, even if they've had a good sleep, they wake up feeling still tired and exhausted. Cognitive impairment is really important, obviously thinking about children in school. And 87% of adolescents and 77% of primary school age children will have a degree of cognitive impairment. So that's huge numbers. And they will have difficulties with sustaining and switching attention, with auditory learning, with recall, and they often feel very fatigued by schoolwork and describe this as brain fog. Children often have difficulties with dizziness and blood pressure problems. So 30% of adolescents and 43% of primary school age children will have these kind of problems. They may feel dizzy, they may faint when they stand up. They often get worsening of symptoms after a hot bath. And this is usually managed by increased fluid intake and salt intake. And we may consider referral onto my colleague in the cardiac clinic for medication for this. Gastrointestinal symptoms are often associated as well. 40% of children are experiencing significant nausea, and often in the morning. It can affect their appetite, and often it's very difficult to treat. It doesn't respond to usual nausea medication. They may also have abdominal pain, and these symptoms can lead to a vicious cycle in children. So if they're nauseous, they've got abdominal pain, they don't feel like eating. So even though they're not doing as much activity as normal, they may actually then lose weight. Or conversely, children who don't have gastrointestinal symptoms and are continuing to eat their normal amount of food, but who are less active because of the chronic fatigue, may then become overweight or obese. So we have to monitor for both of those quite carefully. And eating little and often may help with the nausea. And interesting, we do seem to have a higher incidence than you would expect of eating disorders within the chronic fatigue group. And I guess that's related to this, difficulties with weight and keeping an eye on that. Other associated conditions that we often see in conjunction with chronic fatigue, as you might expect, low mood and anxiety. And it's often a difficult one to know which came first. Have they got tiredness and fatigue because they've got a depressive illness, in which case they maybe don't actually meet the criteria for chronic fatigue? Or is it, as you might expect, understandably, that because they've had the chronic fatigue, it's affecting their lifestyle, their social interactions, that has impacted on their mood and caused anxiety? And they often run hand in hand. Fibromyalgia is more diagnosed in adults. There aren't actually criteria to diagnose that in children. I think there's a big overlap between the two conditions. I see them as part of the same spectrum, but fibromyalgia is more on their aches and pains and muscle and joint problems rather than the fatigue side of things. Children often have headaches or migraines, irritable bowel syndrome, hypermobility and Ehlers-Danlos syndrome. A lot of the support groups, the patient groups, feel that there's a big overlap with those with chronic fatigue. And positional orthostatic, excuse me, tachycardia. This is children who, when they stand up or sit up, their heart rate goes up and their blood pressure goes down. So that, as you would imagine, can be associated with dizziness or collapse. And as mentioned before, eating disorders. Fluctuations are part and parcel of chronic fatigue, so we expect that the symptoms and also the severity will vary over time. This can be triggered by things like a viral illness or by overexertion, but it can occur without any obvious trigger. And it's really important that parents and children and teachers as well are aware of this, and that it's to be expected as part of the progress of the chronic fatigue. Otherwise, people can get quite despondent if they think they're doing well and then they suddenly have a relapse. So managing that should be part of the plan so that they know what to do if that happens. So why is chronic fatigue important, particularly for schools and teachers? So the chronic fatigue is the commonest cause of school absence. And obviously that has lifelong consequences in terms of academic achievement, whether children go on to university or apprenticeship, what they want to do with their life. So, huge impact there. 50% of children with chronic fatigue will be bedbound at some stage. And obviously that can affect social isolation. They're forced to give up hobbies and things that they enjoy outside of school. Parents taking time off work to look after children. Often parents end up having to give up their employment to be at home with their children, which then can impact family finances. And if you look at the point prevalence of chronic fatigue at any one time, between 1% and 2% of children at any one time will have chronic fatigue. So looking at a fairly small high school with, say, 500 children, you would expect to have 1 or 2 children per academic year. So quite big numbers. This was an academic study that was done by Esther Crawley, who is a specialist in chronic fatigue in the Bristol and Bath, and she runs a specialist chronic fatigue clinic. And she looked at studies with including 211 children with chronic fatigue syndrome. And she found that 62% of those children were attending school for less than 2 days a week. So less than 40% of the maximum possible, which is quite big numbers. And that 68% of children in this study reported that chronic fatigue was preventing them from attending school at some stage in their illness. And the average time taken out of school was 1 year. In the study, they found that reassuring that children and young people are much more likely to recover from chronic fatigue than adults are. And I always stress this to children in clinic that they shouldn't look at websites and information about chronic fatigue in adults because it's a much worse outcome. In the studies they looked at, there was recovery or significant improvement in symptoms in between 54 and 90% of children who were treated. And that 75% of the children were attending full-time school after 6 months. So looking at the guidelines that we have for managing chronic fatigue, there was a document from the Royal College of Paediatrics and Child Health back in 2005, which is what I used to initially set up my clinic. Then the National Institute for Care and Excellence produced an initial document in 2007. And as I say, it was supposed to be updated last year, but the changes were quite controversial. There was a lot of discussion, and that was finally produced actually just earlier this month. So the Ipswich Chronic Fatigue Clinic, which is where most of your children and young people will be attending, children come to see us. They have an initial 1-hour appointment with myself, and that's looking at diagnosis and providing some initial advice, which we'll come to further in the talk. And then once they've had that initial advice from me, they would then be referred back to see our physiotherapist, probably in around 2 to 3 months' time. And at that stage, she would review the progress based on my initial advice, and she will then update that. And she has a yellow booklet that they work through, looking at baseline of activity and looking at what children should be doing. And then once they've seen the physiotherapist, they then would come back and see me. And I aim to see most children at least once a term, particularly those who are on reduced timetables, so that we can provide advice to schools in a timely manner. And we liaise closely with Kate in the hospital school if needed. So just going into a little bit more detail about the diagnosis in clinic. So the diagnosis is actually based on the history from the child and the parents. And I think this can be difficult because obviously most of the time that's absolutely as it stands, but sometimes, you know, we do have to sort of dig a little bit deeper into that. The investigations are not to confirm a diagnosis. There is no test for chronic fatigue, but it's important that we do the necessary investigations to rule out other causes of those symptoms. And that would be some basic blood tests. Depending on what the symptoms are, it may include scans, perhaps an MRI brain scan if they're having headaches, perhaps an abdominal ultrasound if they're having abdominal pain. But really that's to rule out other causes. I think it's really important that we avoid unnecessary investigations. And sometimes children perhaps have been to other paediatricians first, and they may have had all sorts of investigations for their symptoms. And actually then they become really anxious that they must have something serious wrong with them because they've had all these tests and nobody can find out what's wrong with them and give them a diagnosis. And actually to be able to say, you know, you don't need any more investigations, we know what this is, can be really reassuring for them. So it's important in that first appointment that we don't necessarily delay the diagnosis while we're waiting for those investigations. So unless from the history I really suspect there's something else going on, if they have those criteria that we looked at early on, then we would make a diagnosis on that first appointment and put some management in place. So the management plan, and we'll look at each of these in more detail, is firstly some advice on activity and energy management and on daily routine. Then we would look at sleep management, about advising and liaising with school, and referring to physiotherapy, and let's just go back one, sorry, and also information on support groups and websites that they can look at. And as I say, it's important that we point them in the direction of appropriate support groups and websites, not ones that perhaps aren't relevant to children and young people. So looking at the activity and energy management, we would start by getting a really detailed history of what they're actually managing at the moment, their day-to-day routine. Are they doing any after-school activities? Really importantly, how much school are they managing, and also the pattern of that. So is it that they're able to go, they're managing to get into school Monday, Tuesday, and then they're exhausted by Wednesday, perhaps coming back in Thursday and then exhausted again Friday? What kind of activities are they doing out of school? What have they had to stop doing? And trying to get an idea of what they can actually manage without wearing themselves out too much. So then based on that, we would be looking to get a baseline of activity. And just going back to that first point, it's important to recognise all the different types of activity in the day. So not just physical activity, but also cognitive. So any, schoolwork, homework, anything like that, emotional activity, and also social. So even just sitting, chatting with friends can be quite tiring, would be counted as activity. So then we would be looking at what we think is their baseline, and that will be in school and also out of school. And we would try to put that baseline in place and judge it from there and see, can they achieve that without doing too much or too little? And then once we've achieved that, we would aim to gradually increase that based on how they cope with that increase. It's really important that we avoid a cycle of boom and bust. And particularly younger children are not very good at recognising their own limits, so they'll just keep going until somebody tells them to stop or until they crash and burn. And in school, you may not see the crash. So sometimes teachers will be saying, well, we've seen them in school, they seem to be able to do PE, they've coped with the school day. And then parents are saying, yes, but then they come home and they're absolutely, exhausted, they can't do anything at the weekends. And children often will want to do more, they feel a bit better, so they rush around and do too much, and then they'll crash again. So it's trying to avoid that cycle. And once we've achieved that baseline, it's important to recognise that if they do have a relapse, we may need to temporarily decrease that, just drop it back a little, and then plan to increase it back to where they were as they come out of that relapse. So looking at sleep management, and some of these children, by the time they come to clinic, are really sleep reversed. So they might be falling asleep at 4 or 5 o'clock in the morning and then sleeping on and off until the afternoon. And obviously that makes school attendance impossible. So it's important that we try and get on top of this. So we're aiming for the same amount of sleep as you would expect for that age group. They shouldn't ideally be sleeping much more. And if they are sleeping until the afternoon, then the idea is to gradually bring that waking time forwards in conjunction with gradually bringing the bedtime forwards rather than doing it suddenly. And then avoiding daytime sleeps if possible. If they do need to sleep in the day, we try and limit that to an hour so that it doesn't affect the nighttime sleep. And then recognising that obviously the limitations of their personal circumstances at home, if possible, we like them to keep the bedroom just for sleeping so that they can do their daytime activities somewhere else, so that when they go to bed, their bodies kind of adjust and know, well, this is where I'm going to go to sleep. And if they don't have space for that additional space in the house, then we would say to keep the bed just for sleeping and have a sort of daytime area with a chair in the bedroom. Really important is to make sure that they switch off all their electronic screens at least an hour before bedtime, and we would encourage parents to try and take all the screens out of the bedroom, ideally completely, but certainly to make sure everything is taken off and switched off and put downstairs an hour before bedtime. Establishing a good bedtime routine, and as I said, anchoring that wake-up time and keeping it the same even on weekends and school holidays rather than drifting back into big long lie-ins. And then once we've done all of that, if they're still struggling with sleep, we often use melatonin, which is a sleep hormone, to try and re-establish the sleep-wake cycle. So coming on to education, as I say, we would look at the timetable and try and work out roughly what they're actually achieving in terms of how many hours in the week are they in school. And we would probably aim to go just below that initially, so maybe that might be 50%. And I usually try and give quite specific advice around that. It's important that we judge that differently according to whether they're primary or secondary school, appreciating that in primary school, children tend to do the numeracy and literacy in the morning. So it perhaps makes sense to go in for mornings only and then have the time off in the afternoon, perhaps with a rest day on a Wednesday in the middle of the week if they're struggling still. Whereas at secondary, appreciating that the subjects will be spread through the week, so we're focusing more on the core subjects, but also looking at the timetable and making sure that there is some meaningful time off, so it's not just that they're in and out for alternate lessons, but perhaps they have some late starts or early finishes and some half days. So I would ask them, usually they have their timetable on their phone anyway, so I'd always look at the timetable and work around the core subjects, and then depending again on where they are in terms of Year 7 versus Year 11, in Year 7 and Year 8, perhaps we would be looking at focusing on the core subjects and perhaps one or two others, particularly on those that they perhaps need to do if they're going to continue with them to GCSE, perhaps like a language. Whereas children in the GCSE years, we might be advising perhaps dropping 1 or 2 of the GCSE subjects, focusing on the core subjects and the ones that they're perhaps looking for their career aspirations. Sometimes children say, well, actually, they'd rather keep going with all 10 or 11 subjects and just drop some lessons. But the problem with that is that then they're kind of setting themselves up to fail because they're still struggling to keep up with all those 10 subjects, but with less lessons. So it's probably better to drop the subjects in a planned way and focus on the ones that they actually need. It's really important that we try and avoid PE lessons due to the physical activity, but also the fact that children don't always recognise their own limitations, as we said, and they might struggle through to the end of a lesson, and then that would have a knock-on effect later. So if they are going to exercise, it's probably better for them to do that away from school, where their parents can kind of monitor that and limit the time, and also it's perhaps not such a busy, noisy environment. And it's important in the PE lessons, sometimes schools will suggest that children perhaps put the PE kit on and perhaps come and referee the other children or sit and watch the lesson. But actually, I would rather they were spending that time in a quiet area, perhaps either resting or catching up on schoolwork or homework, rather than being in that noisy PE lesson. So as I say, it's better to do things in a planned way rather than an ad hoc way. The other advantage of that is that school then know when the children are meant to be in and when they're not. So, you know, the office are not constantly phoning parents wondering where they are. And then the other thing is to remember that social time is important. So we would always try and factor in some break or lunch times around the part-time timetable so that they can still keep social interaction with their peers. You might want to consider an individual healthcare plan, which I know Kate is going to talk a little bit more about at the end, and Kate and I are often involved in drawing those up. For children who are struggling with school, we would perhaps consider some home tuition or online learning. And again, this will perhaps be factored into where they are in their school journey. So being pragmatic, perhaps children who are in year 11 who are really struggling, I might suggest, well, actually, if we can get this child their GCSE maths and English via some tuition or online learning, then at least that allows them to progress on to next year to do what they want to do without having to worry about the English and maths. And we would perhaps not worry so much about the other subjects, whereas children lower down the school, we would be saying, well, the aim is to get them back into school in the long term, and we would perhaps supplement that with some online learning. We do have an information leaflet as well, which we try to send out to schools, and I've got the main points from that on another slide. And then also we provide in year 11 the letters to go to the GCSE exam boards, which again, I've got the points of that. So the advice leaflet summarises all that we've talked about this afternoon, but it also gives the specific advice, as we say, to avoid PE, use the time to rest or to study, to look at perhaps flexibility in homework deadlines, so that children can work when they feel able to, looking at the reduced timetable, encouraging socialisation with peers, looking at home tuition, and also to consider the physical environment in school, because it's quite a busy, noisy environment with the artificial lighting, which all impacts on that cognitive ability. So we would sometimes suggest that children have a medical timeout card, so that if they do just feel that it's all getting on top of them, they could perhaps just take 10-15 minutes out to go and rest in a quiet designated area. And that might enable them to come back then and then be able to manage the rest of the allotted day rather than having to be called to go home early on that day. And we would always review the arrangements regularly. So as I say, I would see children at least once a term and provide updates to school, and I'm very happy for schools to contact me in the interim. The exams letter, I'm sure a lot of you will have seen this, and it's the standard letter that we do for everybody. And the idea is that then the pupil and the parent would discuss that with the exams officer in the school as to which of these they may need. They won't need all of them. But things such as extra time, rest breaks, perhaps delaying the exam start times if they're early in the morning, using a scribe or a laptop, not sitting more than one exam in a day, or perhaps sitting in an alternative quieter venue. And I usually aim to send those out about December time each year. And that was all I had to say. I'm just wondering if there might be any questions.
Thank you, Isabel. There's nothing in the chat bar, so it's over to you if anyone wants to ask any questions. I do have one myself, but do feel free to unmute yourself. I'll start with my question, and it's a general one really, from perhaps my experience. Do you find that schools are generally supportive for our young people who have chronic fatigue syndrome? And I expect the answer will be it depends on the school perhaps, but what's your experience?
Yeah, I think it does depend. What I would say is I think over the 15 years I've been doing the clinic, perhaps schools have more of an understanding, perhaps they've had more children coming through with chronic fatigue, so it's definitely improving. And I think often once schools are very grateful for the advice that we provide, or I hope they are, they seem to be. And once we do give the advice, generally schools will do their best to implement that, absolutely. I
just feel from my experience that it's sometimes misunderstood, and it has been with colleagues, in fact, indeed by myself a few years back when I was still in mainstream. I think that we didn't really have the understanding that perhaps we do now. So, for example, with any other diagnosis, if I was to go to a school and ask for support, they'd bend over backwards to help with a medical need. But when it's chronic fatigue, sometimes it's a little bit misunderstood, and it's not quite the same reaction that you would get from other diagnoses, if you know what I mean.
Yeah, definitely. And I think the other thing is often because children have perhaps been out of school or in and out of school for a long time before they manage to get referred and get the diagnosis, it may be that schools don't know they have chronic fatigue, and schools have understandably then perhaps had some safeguarding concerns, or they've referred them to the Education and Welfare Service. Parents often come quite distraught to clinic because they feel they're going to be prosecuted because the child's not in school. And I think sometimes it's just sort of putting a halt to all of that and saying, well, no, there is a genuine medical reason, and providing the letters and the advice. But I think generally once the advice is provided, on the whole, schools are very good at supporting. And over the years, I've kind of come to know some names in the sort of particularly the bigger high schools who perhaps have more students with chronic fatigue. I do have some names that I can contact and write to, which is really helpful, who perhaps have that understanding.
Yeah, I mean, it is really hard, isn't it, for our young people with chronic fatigue syndrome. Often they do not get the support for their medical condition, perhaps, that they deserve. But it's really good to hear that your experience is that over the last 10 years or so, schools are beginning to understand a little bit more. If there are no more questions, I just want to share with you the toolkit that we have on chronic fatigue syndrome. So to help schools, our colleagues over at Oxford Medical Needs in Schools, they've put together a toolkit, and it's available on our website. Thank you, Laura. She's just putting it up on the screen there. Are you able to scroll right down to the bottom, Laura? There's lots of information, and I know you can't see that very well, but those of you that will remember an APP grid, right at the end of the document, they've put a kind of a progress chart for our children with chronic fatigue syndrome. So I do feel that this is really useful. You would highlight where they are now, and perhaps you'd put your plan in place with your IHP. And then you can highlight where they are in, say, 6 weeks' time, or maybe the next time you review their IHP, to see that the progress that they've made with the plan in place. Just above that last slide, there are also lots of scripts that you can use when you are planning together. And if you keep going up, Laura, you can see lots of, I know you can't read that, but there's lots of things that a teacher can say to support a young person. So ideas of how we can write an IHP and put a plan in place so that this young person is supported. And these have all been written by a clinical psychologist, really to support the mental health as well as the physical health of our young people with chronic fatigue. So please do take a look at this toolkit if you are supporting children with chronic fatigue syndromes, because it's completely written with schools in mind to support you. Okay, well, if there are no more questions, have you got a question?
Just before you finish, just to say that I'm always really happy to hear from schools. You know, sometimes teachers or support staff will contact me, and it's just lovely to hear from them, and it's so nice to be able to work together to support young people. So please always feel free to ring me or drop me an email.
Many thanks. So thank you very much for your time this afternoon, everyone, but particularly to Dr. Burgess for your time today. It's been lovely to hear your advice and your knowledge to be shared with us. So thank you. Just before we go, I just need to let you know of our next workshop that we are going to run, and that's on the 1st of December at 4 o'clock. Our next workshop for medical needs in school is titled A Healthy Diet. What does this mean for our children? And this is going to be run by one of our dietitians, Colette, who works here with us at Ipswich Hospital. So please do feel free to drop in for that. Many thanks again, everyone.
Thank you.